The following is a special presentation of NCC TV brought to you by Newcastle County Government, Thomas P. Gordon, County Executive.
Good morning. Welcome to Abson Jones. Today we have the introduction of the Delaware Health Insurance Marketplace Kickoff. A lot of important subjects are going to be discussed here this morning. We're honored to be able to host it. We have Maria Cabrera coming in from Wilmington City Council at large. Jim McDonald's here from my office, Chief Administrative Officer, or Chief of Staff rather. And let me say these are very complicated, important items. And my job here, and I'm honored to introduce the hardest working secretary in the state of Delaware, Secretary Rita Landgraf, Department of Health and Social Services, and friend of all in Newcastle County. Thank you for coming here this morning, and good luck with all the exchange of information.
Good morning.
Good morning.
Thank you, County Executive Gordon, for hosting us here for our Marketplace Kickoff event. There is something appropriate in being here in this building named for Absalom Jones. As many of you may already know, he was an abolitionist, a church founder, and a man who believed in freedom and justice. He also offered assistance to those in need. In the late 1700s, Absalom Jones was living in Philadelphia during the yellow fever epidemic. While many fled, he stayed, building a team of people to actually nurse the sick. He was on the front lines of care. Today, we are on the front lines too. In the area of health, whether it is fighting today's epidemic of addiction or transforming our healthcare system to achieve better health outcomes, better patient experiences, and lowering the cost of healthcare, or achieving access to care by gaining access to health insurance through Delaware's Health Insurance Marketplace. At its core, the health insurance marketplace is indeed about connecting people, individuals and their families, to coverage and to care. That care can help someone better manage their diabetes. It might detect a breast cancer before it has a chance to spread, or in cases of unexpected accidents or injuries, you won't have to worry about going into debt in order to pay for the care because you are now covered by insurance. I have said all along that if all we do is help people gain access to health insurance coverage, we have failed and we have not done enough. The real success lies in connecting people to quality health care and to improving the quality of life for all Delawareans. So, on Sunday, November the 1st, it will mark our third open enrollment season for the Marketplace. Now, what happened? Last year, during the second season of our open enrollment, 23,163 Delawareans enrolled for coverage on the Marketplace. In addition, more than 9,000 Delawareans were eligible for coverage through our Medicaid expansion. That's a lot of lives accessing care by the Affordable Care Act. So starting on Sunday, November the 1st, and running through January the 31st, we'll work to continue to build on the number of lives gaining access to insurance as the open enrollment begins on our marketplace during this third season. In a few minutes, you will hear from someone who has not signed up yet on the marketplace. She thinks she may be ready now to do so. Like a lot of individuals in Delaware and across our country, she was unaware that there is financial assistance in the form of tax credits, and it is available to assist in reducing the cost of monthly premiums. As we know, in Delaware, about 84% of Delawareans currently enrolled in our marketplace do indeed receive these tax credits to help pay for their coverage, and those tax credits average about $260 a month. That is of assistance in making plans more affordable for our citizens. And that is why she and others like her can connect with a marketplace guide who are there to assist people through that process and help them understand what may be the best plan for them. Again, starting on Sunday at healthcare.gov, we will build on the success of the first 2 enrollment seasons. We will remind those who didn't have health insurance or might be underinsured that along with their first apartment, a new car, a new job, or having the kids in school, health insurance is something they need in their lives. To further our goal of outreach and engagement, we will reach out to populations and communities that we may not have reached last year. We're having this press conference at Absalom Jones for a reason. It is in an area that we believe more people could benefit from health insurance marketplace coverage. This area right here at Absalom Jones joins some others throughout our state: Newcastle, Smyrna, Dover, Georgetown, and Seaford, where we think more Delawareans need to hear the message about how the health insurance marketplace can connect them to insurance and access to quality care. Earlier this month, I had the honor of spending most of the day at the Latino Summit at our Chase Center. In large groups and smaller ones, we talked about how we could build a more culturally competent healthcare system for our state, and one that addresses the disparities we see among the Latino population. Above everything else, much of what we talked about boiled down to trust. How do we get it? How do we build it? That same principle applies to reaching our Latino families when it comes to our marketplace. Across the healthcare system, whether it's through an insurance agent or broker, whether it's through our hospitals or a federally qualified health center, or sitting with a bilingual marketplace navigator, we will convey this simple idea. Health insurance is the way to protect you and to protect your family. In a few minutes, you will see that reaching Latinos will be an important part of our marketing campaign. Still, across all of the populations we must reach, we have heard criticisms and we have heard concerns that the premiums, the deductibles, and the co-pays are still too high. We have more to do in this area of cost, and that is why health reform, or what we call transformation, focuses on the delivery of health care and the associated cost of that health care. I would like to recognize our partners at the Department of Insurance, in particular Paul Reynolds, who's with us today. I would also like to recognize Commissioner Karen Weldon Stewart, who's not able to join us, and all the people from the Department of Insurance who make sure that the rates accurately reflect the costs that insurers have incurred. I invite those who are uninsured or underinsured to go to the website, healthcare.gov. There you will find a new feature associated with all of the plans to help you understand not only the cost of premiums, but your out-of-pocket expenses like your co-pays and your cost sharing. It is a true picture of what you will spend on health insurance and quality health care. For those who say they will take a chance or just pay for the medical expenses as they incur them, we do want to remind everyone that in addition to those expenses, federal law requires those who are eligible for health insurance to have it, or they will have to pay a fine. For the year 2016, that penalty goes to $695 for each adult in a household and $347.50 for each child in a household, or 2.5% of your household income whichever is higher. In a few minutes, Alex from AB&C is going to show you the new look for our website, choosehealthde.com, and where to find our penalty calculator that has been so popular on our website that states across the country want to use a calculator to calculate a penalty. For those already enrolled on Delaware's Marketplace, I do remind individuals to go ahead and shop on healthcare.gov beginning on Sunday, November the 1st. People who shopped last year and compared plans ended up saving money and/or finding a plan that better suited their individual needs or the needs of their families. This year, there are 29 individual plans that you can shop from. For all Delawareans who are planning to enroll or to re-enroll, the process is simple. Last year, it took people about 10 minutes online to submit an application. And for those who are currently enrolled, I do want to offer this reminder that all plans end December the 31st, no matter when your coverage begins. People who are renewing their plans, I do encourage you to at least go to the marketplace and shop around again to see if the plan you're currently on, we do auto enrollment, but you should take some time and look at those other plans as well. You may get a better deal. So you must enroll on the marketplace December the 15th if you want your coverage to begin January the 1st. We are excited to begin this third year of open enrollment on Delaware's Health Insurance Marketplace because we do indeed know it's about the people, a healthier Delaware to come. And now it is my extreme pleasure and honor to introduce Paul Reynolds, Chief of Staff for our Delaware Department of Insurance.
Good morning, everyone. I'm going to put the glasses on even though look how big that is and I still can't see it. First of all, I want to thank Secretary Landgraf. I echo the county exec's sentiment. She's the hardest working secretary in state government. There's no question about that. I want to thank the county executive for providing the host site for today's press conference. My comments are going to be very, very brief. I'm here because Commissioner Weldon Stewart is up in Rhode Island for the Northeast Zone of Insurance Commissioners and Insurance Superintendents, discussing a myriad of insurance issues, not which of, maybe at the front page of everything is the Affordable Care Act and some of the challenges that continue. Which leads me into rates. The Secretary spoke about rates. I can assure you that Commissioner Stewart works very, very hard to keep the rates as low as possible. That has been an extreme challenge, especially in Delaware. She has tried to encourage other companies to come to Delaware for competition. She has reached out to many companies. It has been difficult because of healthcare costs in Delaware, especially those associated with hospital stays. She gave me a call last night from Rhode Island. This subject matter came up with the Commissioner of Maryland. So she looks forward to working as a member of the Healthcare Commission and with our partners. She looks forward to the initiatives and recommendations of the state innovation model. Now, as far as insurance, the department urges you obviously to go to the Navigator site. We also urge you, as the Secretary said, to look at and talk to agents and brokers. Talking to those folks does not cost you a cent. We urge you to speak to them so that you may or may not get, well, you will get the best program and coverage that is possible for you individually. After you enroll, if you have problems with their company, please call the Delaware Department of Insurance. We have a consumer division that works very hard, not only for healthcare issues, but all lines of insurance. Please call us. There is something that is unfortunate at this time of the year. Nationally, there's an uptick of fraud. We have a fraud division that works out of Dover, and we will investigate any kind of concerns for fraudulent behavior. If someone calls you on the phone and tries to solicit their product to you, I would urge you to call the Department of Insurance, and we can make sure that that phone call is the way it should be, and they're a reputable outfit. With that being said, that's about it. This is pretty exciting. We work in the Department of Insurance, and we hope that everyone gets health care. We really do. You all get health insurance throughout the state of Delaware. The commissioner has been here 2 years in a row. Unfortunately, she just could not make it. So I sincerely thank, as the Secretary thanked the Department of Insurance, I thank the Department of Health and Social Services for our cooperation. Thank you so much.
And now it is my pleasure to introduce Alex Perkowski, who is the Marketing Director, AB&C Creative Intelligence, who's going to give us a brief preview of the marketing and outreach campaign to get more people enrolled on our marketplace. Alex?
Good morning. In terms of the campaign development, as we were developing the campaign, we looked at both local and national research to really hone in on our key target audience and our messaging. In terms of the campaign, the target audience is going to be all Delawareans ages 18 to 64. We're really going to focus on the priority populations of young invincibles, 18 to 44 years of age, and priority zip codes that were identified from the research. The key messages that we want to really hone in on this enrollment period and get across are the general awareness about the key enrollment dates. The marketplace opens on November 1st and closes on January the 31st. Affordability. The fact that financial assistance is available to get health insurance. The law and tax penalty associated with not getting health insurance. The fact that free in-person assistance is available through navigator organizations and agents and brokers. And also how to use health insurance. In terms of the creative direction for the campaign, we wanted to hone in on milestones in people's lives and important dates and key events, responsibilities in our target audience's age groups. And the checklist theme is the overarching campaign concept that you'll see woven throughout the campaign concepts. The first tactic that I'm going to show is a TV spot. This is geared towards the 18 to 40 or the 18 to 29-year-old target audience.
Your own place. Your own ride. This one's on you. Getting back in shape. Health insurance? It's time. The health insurance marketplace is open. See how affordable your health insurance can be. The day shift. Smart shopper. Girls' night in. Nighttime bonding. Health insurance? It's time. The health insurance marketplace is open. See how affordable your health insurance is.
So again, the key message is really hone in on the it's time and the affordability factor along with the key enrollment dates. Some of the other media tactics that we're going to be using for the campaign include radio, both in English and Spanish, print ads, again, both in English and Spanish, laundromat signage that will be placed as posters in laundromats throughout the state. They'll be both in English and Spanish, and billboards. The one thing that we're really excited about is the direct marketing media tactics that we're going to be using as part of this campaign. So as Secretary Landgraf mentioned, there's key zip codes throughout the state that we were able to really hone in on from some of the state enrollment data from last enrollment period. And so we were really able to focus on zip codes that we saw lower enrollment in. the different pieces that will be used are a direct mail piece and a door hanger. The door hanger will be in both English and Spanish. In terms of our digital media tactics, we'll be using Google and Bing search and display ads, Facebook, both video and newsfeed ads, the Cinema Network, which is Fandango. Essentially during the holiday season, a lot of people are going to the movies and looking for movies to go see, so Fandango is what we'll be using. Ads will be served up on that network. Mobile ads, and then Pandora streaming radio. The Pandora ads will be in both English and Spanish. All of the tactics will lead to Delaware's resource for health insurance information, choosehealthde.com. Here you'll see the homepage for the site. It's broken down by target audience, and the main component that we're going to walk you through today is the individuals and family section. Some of the key components on that section, you're able to actually go and find out what the cost of not enrolling in a health insurance plan will be, and calculate the tax penalty. And then also we have some call to actions there on how to enroll, the importance of getting coverage, and how to use your coverage once you are enrolled. The tax penalty calculator, as you can see, is a great feature on the site for people to see how affordable, the cost of not getting health insurance versus how affordable it actually can be for you. So that's an overview of the campaign. We're really excited for the campaign launch. All of the tactics will begin running on November the 1st.
Thanks, Alex. We hope that you enjoyed our outreach campaign, and you'll be seeing a lot more as we approach November the 1st throughout January 31st, since that is the open enrollment time frame. It is now my distinct honor to welcome Nancy Lemus, and she's going to talk to you about why this is important through her lens. Nancy is a hard-working mother, and I became acquainted with Nancy through her son, Christopher, who is a young man, a young boy with rather significant disabilities. You may have seen Nancy. Nancy had the honor of actually being with the Pope when he was here in Philadelphia, and I believe the Pope blessed Nancy and her son Christopher. But Nancy is such a passionate advocate for her son, and she and I have been talking about how can we create improvements in order not only to support Nancy as that parent to a child with a significant disability, but also how we can better support Christopher so he can thrive in his life. And I'm just very grateful that Nancy took time out of her extremely busy schedule, working as well as supporting Christopher, to be with us this morning.
I want to start by thanking Rita and Jill for inviting me today to let you know a little bit how my life is and the difficulties that I have with my son. Because my son is not your typical 10-year-old, my expenses with him are a little bit more than what you would expect. There's things that insurance doesn't cover, certain waters that his machines need that has to be distilled water. We go through a lot of those in 1 week. Christopher is my forever baby. He needs baby wipes, and these are things that are not covered by insurance. I work in the restaurant industry. I work really, really hard. I work 6 to 7 days a week. I'm a server, so therefore my money changes. I can walk out with $60 the same way I can walk out with $2. So my money changes all the time, and this is something that I had mentioned to them at the Latin Summit, that I was worried. I don't want to be penalized for not having insurance. I know I need insurance. I need to be well so that I can take care of my son. By being a caregiver, like many of you might be, you know that you walk for 2, you carry for 2, you do everything for 2. If I became injured, what would happen to my son? Who would really be there to care for him? We know that in-home care does not supply you with 24-hour care nursing. So if anything happened to me, that would maybe put my son in a high-cost facility because Christopher needs high-quality care with skilled nursing. because I love my son dearly and I want him to stay home. I know that it's very important that I stay healthy so that I can provide for Christopher, but if I'm injured, how would I do that when we do know that there are a lot of limitations to what the government can provide for us, and we all know that 24-hour care, the only way you're going to get it is if you're institutionalized. I love my son too much to let anybody take over and take care of him. So it's very important that I stay healthy. It's important that I can access, I have a thyroid condition. In the past, there was one time where I didn't have the money to pay for my thyroid medication, and I suffered a lot. I felt, you hear all the side effects of Lyme disease? That's how I felt. That's how sick I was. My skin was itchy, I was exhausted, I was tired, there was no explanation for it. The reason was, I wasn't taking my medicine. Why? Because I didn't have the money to pay for it. And I'm very happy that Rita and Jill reached out to me and said, you know what, Nancy, maybe we can help you. So I am really hoping that leaving today, I will have the knowledge that I need so that I can get the health insurance that can help me take better care of myself. And I also have an adult child that lives at home with me that also helps me take care of Christopher. And I do worry that one day my daughter might get injured taking care of Christopher because Christopher is bedbound, so we have to carry him. My daughter, when she was about 17, actually injured her back carrying Christopher. So it's not just me that I have to worry about too. Now I also have to worry about my daughter's health, that she doesn't get injured because she's my backbone. She is the one person that helps me care for her brother when I'm not around, when nursing's not there. It's the two of us, so it's the two of us that take care of Christopher, so I need to make sure that everybody in my household is healthy. And looking at the video, watching the child sneeze and the mom being like, oh, don't get sick because we have no health insurance. That has been me many, many times. And because I don't have health insurance, sometimes you just don't go with the things that you need. I have an injured ankle, but right around when I injured my ankle, my Medicaid ended. So I did not go through the physical therapy they asked me to go through, and I'm actually suffering the consequences now because I'm a server, I'm on my feet all day, I have to walk fast. If I want to make that money, I have to walk real fast. And when I sit and I stand, my ankle hurts. And this is all because I couldn't follow through with the treatment that I needed because I didn't have health insurance. So I'm really hoping that after today, I can get health insurance and I can follow up on this leg because I cannot be walking around on a sprained ankle. Thank you guys so much for having me today.
Real people, real lives, real stories, and people who do indeed need access to that health insurance. You see how critically important that is. We hope that nobody will experience an unexpected accident or injury, but we know that things happen, that we can't prevent that. And in order to protect individuals, health insurance is a step in that direction. So again, let's give an applause for Nancy for sharing. And I also would like to appreciate Executive Tom Gordon, who opened up the Absalom Jones Center for us to be here today and hosting us. Thank you again. Enrollment begins this Sunday, November the 1st, and goes through to January 31st. Again, we want people to be aware how critically important insurance is. We are committed at the state to continue to look at the cost of this insurance and how we can bring down that cost through our reforming of our healthcare delivery system, and at the same time provide better outcomes to you as consumers of health, as well as a better experience at a lower cost. Thank you all for being with us today.